Hi, let's see an NCLEX RN video based on care for patients with brain disorders. The brain disorders which we discuss in this video are headaches, brain tumors, seizures, meningitis, Parkinson's disease and Alzheimer's disease. A patient with a brain tumor has been admitted to the hospital due to changes in the level of consciousness. The nurse correlates the action of which medication to the treatment of suspected increasing cerebral edema. Dexamethasone, phenytoin, carbamazepine, furosemide. Dexamethasone is used to treat and prevent local cerebral edema, as dexamethasone is shown to stabilize the cell membranes to prevent the occurrence of cerebral edema. Phenytoin and carbamazepine, they are anti-epileptic medications, and furosemide or Lasix, it is a diuretic. The nurse correlates increased ICP in the patient with meningitis to which pathophysiologic process? Increased production of CSF, decreased reabsorption of CSF, increased turbidity of CSF, decreased protein levels in the cerebrospinal fluid. The inflammatory process within the meninges leading to increased turbidity of CSF causes sluggish flow of the CSF. That is why there is increased ICP in patients with meningitis. If you see the protein level in meningitis, it is elevated in patients. A patient is admitted for evaluation and treatment of generalized tonic-clonic seizures. Which clinical manifestation does the nurse assess for this type of seizure disorder? Persistent jerking movement of one half of the body, unilateral jerking movements of one extremity, muscle flaccidity followed by tremors of all extremities, stiffening of muscles of arms and legs followed by jerking movements. Tonic-clonic seizures are characterized by loss of consciousness. A tonic phase marked by rigidity followed by rhythmic jerking movements of the extremities in the clonic phase. Unilateral jerking, it is characteristic of a myoclonic seizure. Muscle flaccidity is associated with absent seizures. In assessing a patient with encephalitis, the nurse notes that when the patient's neck is flexed, the legs also flex. The nurse documents this as which of the following: positive kerning sign, positive Bredensky sign, knuckle rigidity or clonus. In a patient with positive Bredensky sign, there is involuntary flexion of the hips in response to the passive flexion of the neck with the patient in a supine position. If you talk about positive kerning sign, it is characterized by pain behind the knee when the patient's hip and knee are flexed at a 90-degree angle and then the knee is slowly extended. Knuckle rigidity is characterized by stiffening of the neck as a result of the meningeal irritation. Clonus manifests itself as a series of involuntary, rhythmic muscular contractions and relaxations. The nurse assesses for which cardinal clinical manifestation in the patient with Parkinson's disease. Select all that apply: rigidity, disorientation, tremor, bradykinesia, dementia, postural changes. In Parkinson's disease, there is resting tremors, muscle rigidity, slowness of movement which is known as bradykinesia, or there may be loss of movement which is known as akinesia, and postural instability, that is impaired balance and frequent falls. Some other clinical manifestations like mood, cognitive and behavior alterations also you can see. So here, if you are seeing the cardinal clinical manifestations included are rigidity, bradykinesia, tremor and postural changes. The nurse correlates which clinical manifestation to a secondary headache: sudden severe onset, tense neck muscles, nausea, tingling scalp sensation. Secondary headache are caused by an underlying pathology such as infection, neoplasm, vascular abnormalities, drug-induced disorders or idiopathic cause, and typically they present with sudden onset of severe pain. When educating a patient with migraine headaches, the nurse include which interventions? Select all that apply. Practice a healthy lifestyle, avoid triggers, use techniques like relaxation and stress reduction, stop taking medication if symptoms subside in order to decrease the tolerance, eliminate all salt and caffeine from the diet. Smoking is associated with headaches. Smoking cessation is indicated for patients with headaches. Additionally, alcohol moderation and reducing the stress through exercise and other non-pharmacological measures may be helpful in decreasing the intensity or frequency of headaches. So we need to avoid the triggers also and use the relaxation techniques. Medication should not be abruptly withdrawn. And the salt, there is no need for restriction or elimination of the salt. If caffeine is a trigger, the patient can consider reducing the intake. Which assessment data does the nurse recognize as the most sensitive indicator of increased ICP? Pupillary, respiratory, loss of level of consciousness, or cranial nerves? Change in level of consciousness is the earliest sign of increased ICP, and it should be reported immediately also. There may be changes in the pupillary, respiratory and cranial nerves, but they are the later signs. A patient with a history of seizure experienced lip smacking and daydreams during a seizure with no loss of consciousness. The nurse recognized these clinical manifestations as associated with which type of seizure? Absence, complex partial, atonic, myoclonic. So, absent seizures may go unnoticed as the patient appears to be inattentive or dreamy. They usually last 5 to 10 seconds and there is minimal, if any, loss of muscle tone. The patient may exhibit automatism like lip smacking or excessive swallowing. Myoclonic seizures present with no loss of consciousness and include brief contractures of muscle that may be symmetrical or asymmetrical. Patient with atonic seizure may or may not lose the consciousness and exhibit sudden momentary loss of motor tone. Complex partial seizures always include loss of consciousness and often are preceded by an aura. Patient may also demonstrate automatism. So here it is absent seizures. What is used to diagnose a seizure disorder? Select all that apply. Electroencephalogram, lumbar puncture, metabolic panel, coagulation studies, electromyogram. Diagnosis of seizure is made via imaging, that is CT, MRI and lab workup to rule out the causes. That is if there is any lesions, tumors, metabolic or any other disorders, and through diagnostic tests like electroencephalogram, monitoring for abnormal electrical activity. Coagulation studies are used to assess the clotting and electromyogram is used to diagnose neuromuscular disorders such as multiple sclerosis and myasthenia gravis. So here electroencephalogram, a lumbar puncture and metabolic panel. A patient with a history of complex partial seizure has a phenytoin level of free level of 3.1 microgram per ml. The nurse calls the patient and instructs the patient to take which action? Stop the medication and make an appointment for the following week with the provider. Continue the medication and make an appointment right away with the healthcare provider. Take an extra dose now and continue with the current regimen. Skip the next dose, make an appointment right away with the healthcare provider. So here you need to know the phenytoin free level, which is therapeutic, is 1 to 2 microgram per ml. So here it is much high. The free level is high and the patient needs to be evaluated by their provider. The patient should not stop the medication or skip doses without approval of the provider, and an extra dose is not needed as this level is above the normal value. Prior to the start of the semester, what type of meningitis can college students be vaccinated against? Is it a bacterial meningitis, viral meningitis, aseptic meningitis or fungal meningitis? The incidence of bacterial meningitis is increasing in settings where people live in close proximity like college dormitories, military barracks and prisons. And the vaccination we provide is Hib vaccine or Haemophilus influenza type B vaccine. It has much reduced the incidence. The nurse monitors which diagnostic result in the patient with bacterial encephalitis. Select all that apply. Isolation of CSF by polymerase chain reaction, gram stain and culture of the CSF, CT, MRI, electromyogram. Cultures of the CSF will be completed for identification of the invading organism, and antibiotics will be aimed at eliminating the pathogen. So gram staining and culture needs to be done. A CT and MRI is performed to assess for signs of infectious process as well as to see if there is any increased ICP. The isolation of CSF via a polymerase chain reaction is used to diagnose herpes infection, and electromyogram is indicated for the diagnosis of neuromuscular disorders. The nurse recognized that the patient with Parkinson's disease is at risk of which complication? Excessive dry mouth due to autonomic dysfunction, facial twitching secondary to seizure activity, orthostatic hypotension due to involvement of the sympathetic nervous system, flaccid extremities related to the increased level of dopamine. Parkinson's disease leads to decreased sympathetic nervous influence on the heart and blood vessels, leading to orthostatic hypotension. Dry mouth is associated with the side effects of levodopa medication. The patient with Parkinson's disease demonstrates tremors, not seizure activity. The patient with Parkinson's disease presents with rigidity, not flaccidity. And this rigidity is secondary to, and also there will be imbalance will be there between dopamine and acetylcholine imbalance. Which clinical manifestations are included in diagnosis of Parkinson's disease? Select all that apply. Flaccidity, total resistance to movement, bradykinesia, tremors and photophobia. Already we have discussed the clinical manifestation shown in Parkinson's disease. And the diagnosis of Parkinson's disease is made when two or more cardinal symptoms with asymmetrical presentations are observed. So here bradykinesia and tremors are the signs and symptoms you will be seeing. What interprofessional team members are involved in the management of patient with Parkinson's disease? Oncologist, speech therapist, occupational therapist, interventional radiologist, physical therapist. So here you need to know the speech therapist complete a swallowing evaluation and make suggestions to promote safe oral intake. They may also have strategies to improve the verbal communication also. The occupational therapist provides strategies to promote independence as well as to offer accommodation that may be needed at the home to promote safety and maximize the independence in activities of daily living. And third one, a physical therapist will provide exercise and activities that maximize the strength, flexibility and movement. The nurse recognizes which is the probable cause of Alzheimer's disease. Exposure to environmental toxins, CNS trauma, unknown, chronic hypertension. Conclusive evidence as to the cause of Alzheimer's disease does not exist. The actual diagnosis of Alzheimer's is made only at autopsy. Neither long-standing hypertension or injury to the brain have been proven to cause Alzheimer's disease. So here it is unknown. The nurse recognizes that supplementation with which vitamin has been found to be help with the symptoms of Alzheimer's disease. Vitamin A, vitamin C, vitamin D, vitamin E. Vitamin E, an antioxidant, may help with symptoms of Alzheimer's disease by decreasing the damage caused by free radicals in the brain. So this is the case scenario. Mr. Johnson is a 52-year-old male with a history of hypertension, type 2 diabetes and obesity who has a smoking history of 25 years. Mr. Johnson come to his provider with complaints of intermittent headaches, generally first thing in the morning. Mr. Johnson tells the provider that his job is very stressful. He takes his medication for diabetes mellitus including metformin 750 mg every day regularly, but only takes his amlodipine 10 mg every day when he can afford the medication. He does not take his furosemide 20 mg every day because it makes him use the bathroom too often. Mr. Johnson's BP is 188 by 92 mmHg with a heart rate of 95 beats per minute. He is counseled as to the need to take his BP medication, given guidelines for diet and exercise, and prescribed medication to assist with smoking cessation. Mr. Johnson is also given a return appointment in 1 month. Later, Mr. Johnson is transported to the emergency department by ambulance. According to his wife, he had a headache the night before, took 2 aspirin and went to bed. He awoke during the night and went to the bathroom. She heard a noise and checked on him and found him on the floor, mumbling incoherently and unable to move his left side. Head CT is done and a CT of his neck to rule out a traumatic injury due to fall in his bathroom. A right frontotemporal mass is found. Mr. John is admitted to the neurosurgical care unit. The CT identifies a brain tumor and he is scheduled for a craniotomy. The mass is removed and sent to pathology for identification. He is extubated without difficulty in the operating room following the procedure and admitted to the neurosurgical intensive care unit. Although his speech is slightly slowed, he is able to move his upper right extremity with +5 strength and his right lower extremity is +4 strength. He is prescribed dexamethasone 4 mg IV or per oral every 6 hours for 48 hours. Again, Mr. Johnson is in the postoperative day 2 following surgery for a right temporoparietal mass. He is alert and oriented. His speech is markedly improved and his spirits are good. He is seen by the speech therapist and passes a swallowing evaluation for a regular diet. Physical therapy is working with him daily. While visiting her husband, Mrs. Johnson begins to scream for help. The nurse finds Mr. Johnson in bed, gurgling with tonic-clonic movements, and he does not respond to her. He is placed on his left side and given 2 mg of lorazepam IV. After 3 minutes, the seizure subsides. The provider comes to the bedside quickly. The nurse tells the provider the details prior to the event, how long it lasted, what the patient was doing during the event, and what was given to control it. Mr. Johnson is ordered a 1 gram bolus of levetiracetam IV and 500 mg IV every 12 hours. An EEG is ordered. The nurse explains to both Mr. and Mrs. Johnson that the potential for seizures post-operatively is high and the bed should remain in the lowest position with the side rails up. Post-operative day 7, Mr. Johnson is ready for discharge to acute rehabilitation. The nurse reviews all medications prescribed for Mr. Johnson with him and his wife. These medications include levetiracetam 500 mg PT, amlodipine 10 mg daily, metformin 750 mg daily, glyburide 5 mg daily, furosemide 20 mg daily. The nurse reiterates the necessity for taking his medication as prescribed. The nurse also introduces Mrs. Johnson to the social worker and a support group is identified to assist her in caring for herself and her husband once he returns home. So this is the case study. On Mr. Johnson's initial presentation to the clinic for headache, the nurse assesses him for which clinical manifestation for increased ICP. Confusion, tachycardia, clonus, elevated BP, incontinence. The earliest sign of increased ICP is a change in level of consciousness that can manifest as confusion, disorientation, irritability, and somnolence. As the ICP increases, the patient may develop bradycardia and an elevated blood pressure. Clonus is related to hyperactive reflexes. So here confusion, and elevated BP you can observe. The nurse correlate with which healthcare team member to arrange for Mr. Johnson to have a swallowing evaluation. Dental hygienist, physical therapist, occupational therapist, speech therapist. So the speech therapist completes a swallowing evaluation and makes suggestion to promote safe oral intake. The dental hygienist may have recommendations about oral care. The physical therapist is focused on strategies to promote the strength and the flexibility. And the occupational therapist support the patient and his family in making accommodations to promote safety and maximize the independence in activities of daily living at home. What is the rationale for administration of dexamethasone to Mr. Johnson post-operatively? Decreases cerebral edema, decreases blood pressure, suppresses seizure activity, suppresses neuromuscular conduction. Post-operatively, patients are given glucocorticoids such as dexamethasone to treat and prevent further local cerebral edema. Dexamethasone have been shown to stabilize the cell membrane and prevent the occurrence of cerebral edema. On the basis of Mr. Johnson's seizure activity, the nurse implements seizure precautions. What equipment does the nurse ask the nursing assistant to place in the room? EEG machine, suction equipment, restraints, padded tongue blade. Seizure precautions include placing suction equipment and oxygen equipment in the room. So here suction equipment. The EEG machine is required to further evaluate seizure activity but is not a precaution. Restraints are contraindicated as they may cause injury to the patient in the event of a generalized clonic seizure, and padded tongue blades are contraindicated because due to the potential to harming the patient if placed during a motor seizure, they can damage the tongue and oral. Which statement by Mr. Johnson indicates the need for further teaching about the levetiracetam? I will not drink any alcohol beverages. I will wear a medical allowed bracelet. I will let my doctor know about all of my prescriptions. I can skip a couple of pills if I have a stomach flu. So here, I can skip a couple of pills if I have a stomach flu needs further teaching. Therapeutic levels of anti-epileptic medications are required to minimize the seizure activity. So if the patient is unable to take the medications due to any illness, the provider needs to be contacted. It is important to avoid alcoholic beverages as they can further sedate the patient, and it is important for the patient to wear a medical allowed bracelet with the name of the medication and the provider for their anti-epileptic medications. Hope you understood this video. Thank you so much.